should be drafted. But even after that, several attempts were made and it did not go very far. In 2008, a different strategy was done. A small core team was formed of Ministry of Health, senior officials, UNICEF and WHO, and one member from Eastern Kenya and University of Nairobi. We were given a new draftsman from the Attorney General to redraft the bill and also take into account the added new World Health Assembly recommendations. By 2010, we had a draft bill that now could go to Parliament. So we gave it to the Minister to take to the Cabinet for approval. And once approved, it then went to the Attorney General, who published it and for 10 days for public review. And in between, there was a lot of industry involvement in terms of them wanting to come onto the drafting, but the government was very clear, you will only see it at the public review, and that's what happened. So after the 10 days of public review, there was the first reading in Parliament, and thereafter there was a lot of activity within the country, between the reading and even within the ministry, with amendments and consensus building on the draft bill. It was then passed on 20th September, and by that time now there was a lot of activity within the country because there were certain clauses that people were not comfortable with. There were efforts to lobby the president, but on 26th October, the president actually signed it into law. So that is the law published by the Kenya government that deals with the breast milk substitute control. And what does it say? It says it's an act of parliament to provide for appropriate marketing and distribution of breast milk substitutes, to provide for safe and adequate nutrition for infants through the promotion of breastfeeding and proper use of breast milk substitutes where necessary, and for connected purposes. That is what saved us, we will say later on. Connected purposes. So it has 5 clauses, and in this there's a preliminary, we have a committee, we have the main body which deals with the restrictions, there's enforcement, and then there's the miscellaneous which deals with the penalties if there's an offense. And under preliminaries, it clearly states that the act binds the government. So even the government cannot violate it. One of the issues that were very contentious was the issue of complementary feeding. Industry and some other players were saying the Breast Milk Substitutes Act should only deal with breast milk substitutes, but not complementary feeding. But this is what we put in. The bold is ours that says a health worker shall not demonstrate the use of a designated or complementary food product to mothers or members of their families, unless in such special cases of need as may be prescribed by the cabinet court, unless the bold is ours there. So this means that we can still use RUSF, RUTF, Plamidose, LNS, because these can be prescribed. They are supposed to be prescriptive foods, and they can be prescribed with permission from the cabinet sector. And that is the permission that can be delegated to lower levels. The regulations then go further on to define what we mean by special cases of need, which means they will allow demonstrations as long as you are using indigenous, locally available food to be consistent with our national food and nutrition policy. So what were the challenges? Many of them. One, there was lack of understanding of the breast milk substitutes bill. Kenya laws actually confine details of regulations into regulations. So if you read the act alone, you may not get it. You need to read it along with the regulations. The World Health Assembly resolutions on complementary feeding, feeding bottles and teas were perceived to be outside the scope of the court because it was not breast milk substitute. Health specialists within the country were actually against the clause that was prohibiting the receiving of research grants, workshops, and scholarships. And the private sector and some international NGOs considered that this act was a violation of the public-private partnership. So they did lobby efforts to stop the breast milk subsidies legislative process, and actually they propagated a lot of discontent within the country, within other NGOs and within other development partners, and they were also now together with industries who wanted to counter the legislative process. So what they did is that they actually came up with the concern, and they said that this act will inhibit education to mothers, it will inhibit the use of multiple micronutrient partners. We will therefore not also be able to use RUTS in the prevention and management of, and treatment of malnutrition. And therefore we will not be able to implement SAN, which we were just preparing to sign on.
And you have 2 minutes.
In that case, they also prepared a policy brief, and the brief was that they were going to have a global and in-country advocacy effort to alert the Attorney General and petition the President not to sign it into law. What did we learn? Development partners have a hidden commercial agenda. And it is important to understand each partner and protect your children from those who have commercial interests. Some development partners like the EGO and the NGOs, INGOs also have conflict of interest. Political leadership and commitment is key for successful legislation. Our minister took it up herself. Plus the senior ministry officials, they must lead the process, not just at departmental level, but senior leadership. You need strong technical development partner support, and in this case we had UNICEF and WHO, and acknowledge David Clark here and Linda Bayer, who is there. And you also need to identify a distinguished university, and we are working with the University of Nairobi School of Medicine. So what is the way forward? We are gazetting the Infant and Young Child Nutrition Committee. We are finalizing the regulations. We will take the regulations again to stakeholder consensus. Then we submit it to Parliament for approval. And we will start with a baseline survey of the code violations in the country to give us a benchmark, so that then we can be able to know as we are implementing and going forward. We need local civil society interest in breast milk substitutes, and we are going to develop that. And we are recommending to the development partner who have a conflict of interest that law binds everybody. Therefore, if they have a conflict of interest in health, can they relocate to the trade sector? Now, you can find our law in that law report and my acknowledgement. So many people, but these are the people that I can be able to acknowledge, and I say thank you very much.